صباح الخير. اليوم 29 شهر ابريل 2018 عم نحكيكم من شماعة كلينيك بالجميرة. And we have a very exciting story to share with you, and it has to do with unwanted hand veins. We have a unique situation here. We have one of our staff that I've treated one hand last week, and today we're going to treat her other hand. So the uniqueness of this, one of the unique aspects of this video is you're going to see on the same patient the hand that was treated a week ago and the hand we're going to treat today. So here we are. If I can have you. So this is the hand that was treated a week ago, and this is the hand that we're going to treat today. You can see how these bulging, protruding veins going all the way down to the fingers give the hand an old appearance. While this hand that was treated, it still needs a little bit of a touch-up here and here, but there's a huge difference, I think, between the two. And I just want to ask, before we start, I want to ask Mahnaz, why did you ask me to do your hand veins? What drove you to do that?
Yeah, well, doctor, I'm totally, to be honest, I'm satisfied with my skin, the face and body whatsoever. But it was since long years back that I'm not happy with my hands. I think they looks much older than my age.
Yeah.
So then I try to hide it many times and whatsoever. Now when I get familiar with you, I found, oh my God, this is the time that I fix my hand.
Yeah. There's a saying, you can tell a woman's age from their hand and her neck. I mean, you're 34 years old, and I think, you know, in all honesty, this is a hand that looks 55. This is a hand more in line with her age. Now, before we treat this, I just want to discuss a lot of hearsays and misinformation, I should say, about this issue. One of them is, oh, these are important veins, you need them, you can't live without them, and your hand is going to be affected, etc., if we treat them. That's really totally true. Allah subhanahu wa ta'ala gave us many sets of veins. We can easily live a normal life without veins. A set of veins, whether it's on the dorsum of the hand or on our legs or on our feet, without a problem. There is one downside to treating these veins, which is the treatment is permanent. The results are permanent. So in the future, if the patient goes to the hospital to have an IV or شيل التغذية or to have blood drawn, these veins will not be available. That's why generally we keep this vein here, the cephalic vein, and in general, patients who have such prominent hand veins usually have very good veins on the rest of their body, like here, you see. And furthermore, nowadays, most of the treatment, intravenous treatments in the hospital, is not done through hand veins, it's done through neck veins. So that's the only downside, or which downside, that's the only thing that the patient needs to know. So this is one piece of misinformation. Another one, and no, oh, we can treat this with fillers. We don't, why, The problem with fillers is the following. These veins are stuck to the skin, okay? They're really under the skin. So when the doctor wants to do a filler, naturally he wants to avoid the veins because you don't want to inject the vein in the filler. The filler is a foreign substance. If it goes into the vein, it causes a bad reaction. So you have to inject around the veins rather than over the veins. You can't inject over the veins. They're stuck to the skin. So this is one issue. Another issue, you end up with a swelling, a filled up hand and fingers that don't match. The third issue with the fillers is asymmetry. Only God can give us asymmetry, can give us two eyes the same, two hands the same, two legs the same. A human being cannot do that. If you put a filler here and a filler here, it's very difficult to have symmetrical result. A third or a fourth, I don't know where we are now, a fourth or a fifth thing, the fillers never last. Whether it's fat transfer, never lasts forever, whether it's fat transfer or or the radius or hyaluronic acid, they have a certain longevity. So every 12 months, 18 months, 6 months, you have to redo it. Well, this is a permanent result. When I started doing this procedure in 2001, and this was actually, by the way, it was the first reported technique and was published in the American Journal of Plastic and Reconstructive Surgery in December of 2006. I used to do the treatment, the technique اسمه endovenous laser ablation, meaning I would go inside the vein with a laser fiber and seal it, especially when we have to treat veins that go all the way up to the forearm. And we had wonderful results. I have pictures, maybe we can intercept them in the video of results of patients 10 years done. As time went on, because this is a costly procedure and it does require local anesthesia, some patients ask me if is there an alternative. So basically, I took the technique that we use for the treatment of varicose veins, of sclerotherapy, modified it a little bit, and I'm using it for hands. I've been doing that for the last 6-7 years, and we're having wonderful results. The thing that you need to know about it, about the sclerotherapy, and we cannot accomplish a result in one session. This is number one. Number two, that there is some bruising. Anna, yesterday, I'm having a CT scan tomorrow. So they took blood to check my creatinine. And this is just, I had a very good nurse here at the clinic do a blood test on me and look at the bruise. So when you inject these veins, you do expect some bruising. I mean, it's normal. But other than that, there is no downtime. She can resume her work right away. Okay, anyway, let's get to work. So we're gonna start the procedure. So Mahnaz is now lying down. We have this blue chalk. I'm gonna put this pillow under because I have to lean my hand so I don't bother her. And we're gonna treat the veins one by one. And I'm assisted, by the way, I'd like to introduce Richie, our head nurse here at Shamma Clinic, and Amy, one of our active and lovely nurses here. They're assisting me in this procedure. And first I'm gonna spray some antiseptic. Thank you. This is just an antiseptic, it's a bit cold. Wonderful, okay. So we'll dry it up. So can you go and give me 2%, please? So we're gonna treat, we don't treat all the veins in one session. We'll show you some treatment of some of the veins and we will carry on. So the first vein I'm going to actually treat, Richie, is this one going up. And I think you're gonna have to put your finger here once I go in. Okay, Mahnaz, all I need you to do is to take a deep breath. I have to use my light to just get in the vein, and probably that part you will not be able to see on the video. That's only for a short period of time. Take a deep breath. Bravo. So I'm inside the vein, I see the blood. I will inject very gently. And no, let me go in more. Now you can push your finger here. So this vein is treated. That's it. Did you have pain, Mahnaz?
No.
Be honest. Okay. Again, I'm going to treat this one here now. Take a deep breath. Bravo. Out. Beautiful. And I'm injecting the medicine, and you see how the vein becomes white. So put your finger here. Fantastic. That's it. Okay? Take a deep breath. Perfect. And you see how the vein and this is becoming white right there, here, right there. See? And we put pressure here. And again, I use very small amounts of medicine. Okay? Now, I'm going to do treatment of some of the finger veins, and we will wrap it up for this session. So these are veins that are really actually very difficult for you to see, but I can easily treat them, inshallah. Deep breath. It's a little bit more sensitive than the hand. Excellent. Perfect. Okay. And there is a vein right next to it. 4 by 4, please. Thank you. Take a deep breath. Okay. I'm inside. Perfect. Fantastic. Okay, that's it. So now I will take a cream. You have to put your hand on my, so this is the way the hand looks after the treatment. We're gonna put a cream that we put after therapy, 4 by 4s, like this, like this. And I intentionally make them going all the way up so that we cover the nose. Can you take my gloves off? For the doctors watching, this bandage should be put in with the hand in dorsiflexion. And again, the trick is make these extend into the fingers where you did the injections, because you cannot bandage the fingers. Okay. Okay. Can I please have the glove? I want to show I would like to show the audience what is it that Mahnaz will be doing tomorrow. Scissors, please. Crepe bandage. Can you take my light off? Thank you so much. So this is a crepe bandage. Again, you need your hand dorsiflexed. Do we have 2 small band-aids? Okay. Can I see you moving your fingers? Good. Okay. 4 by 4. Maybe we should go to the pediatric department for band-aids. Or you have? Anyway, we will put 2 small band-aids here. This is the whole idea. Sorry that we didn't have them prepared before. So this is the glove that Mahnaz will be wearing tomorrow, or actually maybe later today. I'm going to show it to you on this hand. Thank you. Yeah. So she'll be using this for 3 days starting tomorrow, and it provides some comfort. It covers any bruising that she might have, and it allows her to take it off any time and wash her hands and put it back. So that's really it. 4 by 4 gloves, please. So Mahnaz, this is it. Basically, as I told you, now you go back to work. Expect some, really you shouldn't have any pain or discomfort. Anyway, we'll be working together today, so if you have any, you'll tell me. And basically, either tonight or tomorrow morning, you can, you'll take this off and you'll put the bandage. Inshallah, let's plan on seeing you in around 4 days. We will do another treatment. Oh, thank you. That's what I was going to do. And that's it. Please, if you have any questions, you can email me or email Mahnaz at info@shammaclinic.com, or you can always call us 04349 8800, Also on YouTube, at the Shamma Clinic YouTube, there's a lot of other videos about the hands. But the uniqueness of this case, the beauty about this case, is we were able to show you the difference, the palpable difference between a hand treated 1 week before and a hand that wasn't treated on the same patient. All of this video was done in real time. We started talking, what time did we start? I think, no, 8 we came, but we set up by the time, what time is it now? 8:57. I think we started this video around 8:30 or 8:35. It's now 8:57. So Mahnaz has 3 full minutes to get ready for our first patient.
Yeah.
You see how considerate an employer I am?
You're great. Thank you so much.
Okay. Have a great day, and we'll have more. Bye-bye.